Right now, somewhere in the world, someone is sitting perfectly still, afraid to move. Not because of a broken bone, not because of surgery, just their back. Back pain is one of the most common experiences in human life. But here is what most people never realize. Back pain is not one thing. It is many different things, each with its own origin, its own feeling, and its own meaning. The sharp stab after lifting a box is not the same as the burning heat that runs down your leg. The stiffness you feel getting out of bed at 60 is not the same as the deep ache that follows you through every hour of office work. Understanding which type of pain you have is not just interesting, it can change everything about how you respond to it. So let's go through them, all of them. Muscle back pain. The most common type, and often the most misunderstood. Your back is home to layers of muscle, thick, powerful, deeply connected to your posture, your movement, and your habits. These muscles work constantly, even when you think you're resting. When you sit for 8 hours at a desk, certain muscles hold tension without release. When you lift something heavier than expected, muscle fibers tear microscopically. When you sleep in an odd position, muscles tighten overnight in silent protest. The result is that familiar deep ache, a heaviness, a stiffness that makes you wince when you first stand up. It is usually broad, not a pinpoint. It moves slightly when you stretch. It gets worse after long stillness, and better after careful movement. This kind of pain is your body sending a message, not an alarm, a message. The muscle is overloaded, under-recovered, or chronically tensed. It wants movement, not immobilization. It wants blood flow, not ice. Most muscle-related back pain improves within days to weeks, but only if you listen early. Disc back pain. Between every vertebra in your spine sits a small disc. Think of it as a shock absorber, a tough outer ring surrounding a soft, gel-like center. These discs carry enormous compressive force with every step, every bend, every seated hour. Over time, or suddenly under the right pressure, that outer ring can weaken. The soft center can push outward. This is what people call a herniated disc, and the pain it causes is distinct from anything muscular. It tends to be deep and electric. It concentrates around the lower spine or neck. Bending forward often makes it worse. Coughing or sneezing can send a spike of sharp pain radiating outward. And here is what makes disc pain uniquely unnerving. It rarely stays in one place. Because when a disc pushes against a nearby nerve, the pain travels down into the buttock, along the back of the thigh, sometimes all the way to the foot. That traveling sensation is the nervous system speaking. The disc isn't doing the broadcasting, the nerve it's compressing is. Nerve pain, or sciatica. The sciatic nerve is the longest nerve in the human body. It begins deep inside the lower spine, passes through the pelvis, and runs all the way down each leg. When something presses against it, a disc, a tight muscle, an inflamed joint, the result is unlike ordinary pain. It burns, it tingles, it shoots like electricity through the leg. Sometimes it feels like water running down the thigh. Sometimes the foot goes numb. Sometimes you notice weakness. Your leg feels slightly unreliable, as though the signal between your brain and your body has been interrupted. Sciatica is not a diagnosis exactly. It is a symptom, a signal that something is compressing neural tissue somewhere along that long, vulnerable path. The source matters enormously for treatment. A disc herniation causes it differently than a tight piriformis muscle. And yet, the feeling in the leg can be nearly identical. This is pain that does not respect geography. It begins in one place and speaks in another. And that is precisely what makes it so disorienting to experience. Joint or arthritis back pain. Your spine is not just discs and muscles. It contains dozens of small joints, called facet joints, that allow your vertebrae to move against each other with control and stability. Like any joint in the body, these can age. The cartilage that protects them thins. Inflammation settles in. Bone can begin growing where it shouldn't. The pain this produces has a particular character. It is stiff, grinding, worse in the morning when the joint has been still for hours, and slowly easier as the body warms up and moves. Cold weather often makes it sharper. Long periods of standing or arching backward can provoke it. This is not damage. This is aging. And while it sounds frightening, the body is remarkably capable of adapting. Many people with significant arthritic changes in their spine on imaging feel no pain at all. The picture inside does not always match the experience outside. There are moments when back pain is not about muscles, discs, nerves, or joints. There are moments when it is telling you something else entirely, something that requires immediate attention. Fever alongside back pain, particularly deep pain near the spine, can indicate infection in or around the spinal column. Unexplained weight loss combined with persistent, worsening back pain, especially pain that doesn't change with movement or position, is something that must be evaluated. Loss of bladder or bowel control alongside back pain is a medical emergency. Numbness or weakness in both legs simultaneously should never be attributed to ordinary back strain. Back pain following significant trauma, or back pain in someone with a history of cancer, also demands careful and prompt evaluation. These are rare, but they are real. And the body, when it needs to be heard urgently, tends to make itself impossible to ignore. Pain that lasts more than 3 months enters a different category entirely. And the reason it persists is not always structural. Often, the original injury has healed. The disc is less herniated, the muscle is no longer torn, and yet the pain remains. This is because the nervous system learns. When pain signals fire repeatedly through the same pathways, those pathways become sensitized, quicker to fire, lower in threshold. The brain begins to treat the back as a region of danger, amplifying signals that would otherwise be ignored. Stress, poor sleep, inactivity, and fear of movement all feed this cycle. The body tightens, muscles weaken from disuse. Inflammation lingers in tissue that rarely moves. Chronic back pain is not weakness. It is the result of a system that was designed to protect you, working too hard for too long without the reassurance it needed. Your spine is not failing, it is adapting, sometimes clumsily, sometimes painfully, but always in response to signals it is receiving from the life you live. Understanding where your pain comes from does not end it, but it changes your relationship with it. A burning leg is less terrifying when you understand the sciatic nerve. Morning stiffness is less alarming when you know the facet joints simply need time to warm. Muscle ache is easier to manage when you recognize it as a response to demand, not a sign of something breaking. Back pain is common, but it is not inevitable, and it is not permanent. The first step toward recovery, more often than not, is simply understanding what you are dealing with.